Welcome students to MBBS Online Lecture 2021. The topic for today's lecture is about Erythroblastosis Fetalis. As we have previously discussed in the previous lectures about the ABO system, RH system. So Erythroblastosis Fetalis is a condition that is directly related to RH system and ABO system. Therefore, we would discuss it in detail here. So let's come to the learning objectives of today's lecture, that is, what is erythroblastosis fetalis? What is RH incompatibility? Signs of RH incompatibility? Diagnostic tools? What are the laboratory tools? What are the laboratory procedure to identify the RH incompatibility? Its prevention and treatment. Let's come to the definition of erythroblastosis fetalis. Erythroblastosis fetalis. We would break this word in erythro means red blood cells. Blast means its precursor or immature RBC. Fossils mean its increase in number, while fetalis mean inside or in the fetus. So the basically meaning of erythroblastosis fetalis is increase in number of immature RBCs or increase in number of blast cells, blast RBCs inside the fetus. So how this is developed? Let's get to the definition. It is a hemolytic anemia in the fetus or neonate caused by transplacental transmission of maternal antibodies to fetal RBCs. The disorder usually results from incompatibility between maternal and fetal blood groups, often Rh antigens. So previously I have also discussed this thing that we are mostly concerning about the two blood group types, that are ABO system and RH system, because these two are of the blood groups or these two of the blood types are always involving the clinical manifestations, such as for the RH antigens or RH system. We came to know about the erythroblastosis fetalis. How this is developed? Basically, it is a hemolytic anemia. So let's discuss it further. Its types of incompatibility. It is APO incompatibility, while it is RH incompatibility. As we have discussed in the ABO incompatibility bit in previous lectures, that the antigen present in a plasma cell, particular antigen present in the plasma cell, its antibodies would be absent. So therefore, no antigen antibody complex will be formed, no agglutination occurs. If this occurs, if same antigen, if antigen with its complementary antibody combines with the antigen, it forms antigen antibody complex that may lead to the agglutination, that is clumping of RBCs, and finally to the occluding of small vessels that occlude circulation and leads to tissue infarction and many circulatory disease. RH incompatibility. Mother is RH negative and fetus is RH positive. RBCs from fetus can go into the mother's bloodstream through the placenta. Since we know that the fetus and mother is ultimately connected to each other by the placenta, where the exchange of materials occurs, such as nutrients, oxygen, carbon dioxide. Rh negative mother's immune system treats the Rh positive fetal cells as a foreign substance and makes antibodies against them. As I have discussed its overview, that the mother having no D antigen, that is Rh antigen, so she may develop anti-D antibodies that may form antigen antibody complex with the Rh positive antigen and may lead to hemolytic anemia. So these anti-Rh antibody may cross the placenta into the fetus. So anti-Rh antibody that develop inside the mother when mother blood is exposed to foreign substance such as fetus Rh positive blood cells. So anti-Rh antibodies can cross the placenta to the fetus where they destroy the fetus circulation red blood cells. Therefore, hemolytic disease of newborn is we called. Okay, this is diagrammatic representation such as Rh negative blood inside the mother while Rh positive blood of the fetus. Through the placenta with any reason, the Rh positive blood crosses placenta and ultimately reaches to mother circulation. When our mother's immune system exposed to these foreign substances that is Rh positive, so they ultimately form antibodies, that is anti-D antibodies. When antibodies are formed, these antibodies can cross the placenta and ultimately reaches to the fetus blood. That may cause the destruction of RBCs, red blood cells of fetus. Now there is a important statement that is firstborn infants are often not affected unless the mother has had previous miscarriages or abortions, which could have sensitized her system for developing antibodies. Okay, so basically, when there is a firstborn infant, and infant is a fetus is a Rh positive, while mother is Rh negative. During labor process, during birth process of first baby, some of the blood cells from fetus can cross the placenta through umbilical cord to placenta and ultimately reaches to the mother circulation, can cause sensitization of mother immune system that may result in the formation of IgM antibodies. IgM antibodies are too large to pass from the placental barrier, so they are not as significant in destruction of the fetus red blood cell. So the firstborn, that is firstborn infant, is totally normal with no sign of hemolytic anemia. Signs: mother polyhydroaminos in mother. Poly mean many, hydro mean water, aminos mean amnios mean amniotic fluid. More water in amniotic fluid in mother. Baby, what are the signs of the baby? Baby would be paler because of the anemia, hemolytic anemia, hepatosplenomegaly, enlargement of liver and spleen. This is due to the extramedullary hematopoiesis that is stimulated by increased destruction of RBCs by the antibodies. Jaundice may not be there at birth since the mother's kidney will take out the excess bilirubin. Jaundice develop in the next few hours of delivery. Basically, jaundice is a yellow yellowish uh, accumulation of excess bilirubin in body. So baby may develop excess accumulation of bilirubin in her or his body that may cause the baby to look yellowish in color. So polyhydramnios, presence of excessive amniotic fluid surrounding the fetus. Okay, this is the definition. As you can see in the picture, healthy baby, while the baby with severe jaundice, it's He or she look paler with increased yellow in color in eyes and nails, particularly. So exams and tests. A positive Coombs test result, direct and indirect Coombs test. Basically, Coombs test is carried due for the presence of antibodies that are self-reacting antibodies, mean auto antibodies that may cause destruction to own or cells tissues. So Coombs test determine the presence of these antibodies. Fetal blood samples, FBS for RH sensitization during pregnancy, a high level of bilirubin in the baby's cord blood. So presence of bilirubin can also be the significant diagnostic test for the RH incompatibility or HDN. Coombs test to look for antibodies, as I have discussed, that may bind to fetal blood cells and cause premature RBC destruction. This is hemolysis. Indirect Coombs test, which is carried in mother, for unbound circulating antibodies against red cell and used to determine if the person have a reaction to blood transfusion. Direct Coombs test to detect antibodies that are already bound to the surface of red blood cell in the baby. Indirect Coombs test is carried in mother. That is a detection of antibodies that are circulating in the blood that are not bound to any cell. While direct Coombs test is carried in baby, which is to detect the antibodies that are bound to RBCs. Fetal blood sampling for RH directly from umbilical cord or fetus, tested for signs of anemia. FBS is also known as chordocentesis or percutaneous umbilical cord blood sampling. Basically, the blood in the umbilical cord is extracted and is studied for the RH sensitization. Means it is directly reacted to the RH antibodies, and if it occurs, so this can be the diagnostic important tool or important mean for the formation detection of HDN. FBS is used to look at fetus red blood cells count and oxygen level, and it also looks for sign that your immune system is destroying fetal red blood cells. This is the FBS. Prevention: how Erythroblastosis fetalis can be prevented. It is by injecting Rh immune globulins inside mother. Rh immune globulin contain antibodies to the Rh factor in the blood. The antibody comes from mother's blood stream that has been sensitized to Rh factor. Giving these Rh antibodies to an Rh negative pregnant woman prevent her immune system from producing its own anti-Rh antibodies which would attack the Rh positive red blood cells. Basically, this Rh antigen, Rh immune globulin is injected in the pregnant woman who, who is sensitized for the Rh positive blood. Means that there are circulating anti-Rh antibodies inside the mother. So these Rh immune globulin blocks the way the Rh antibodies are produced and prevent attack to the Rh positive red blood cell of the fetus. Given to all Rh negative women who may be carrying an Rh positive fetus, it is given to the basically Rh negative woman. It cannot prevent damage to an Rh positive fetus if the mother is already sensitized to Rh factor. So this is the main statement and main disadvantage. Basically, if a mother is already sensitized to Rh factor, so there are circulating antibodies against that Rh positive blood. But this Rh immune globulin cannot destroy those circulating antibodies, but it can block the pathway from which the Rh anti Rh antibodies are produced. Okay. Rh immune globulin should be given to an Rh negative woman to prevent sensitization. It is given at 28 weeks of pregnancy. Baby should be treated with aggressive hydration, early phototherapy, early exchange of transfusion if required. Basically, phototherapy is used to remove excessive bilirubin. That bilirubin may cause cardiac arrest, which is an accumulation of bilirubin in the central nervous system that may lead to impairment of CNS. Okay. Early exchange transfusion is basically transfusing the Rh negative blood to Rh positive blood. The Rh positive blood of the baby's whole is extracted, and Rh negative blood is injected to that baby. And after sometimes after 6 months, those Rh antibodies that are transferred from mother circulation to baby circulation are eventually destroyed, and after that much period of time, baby may develop its own Rh positive blood. Antenatal management. Mother's titers positive, rise in titers, giving NTD to mother, amniotic bilirubin. Okay. This is a fetal blood transfusion. Let's discuss it. Transfusions can be given through the fetal umbilical vein. An intrauterine infusion provides blood to Rh positive fetus when fetal red cells are being destroyed by Rh antibody. A blood transfusion is given to replace fetal red cells that are being destroyed by the Rh sensitized mother's immune system. This treatment means to keep the fetus healthy until he or she is mature enough to be delivered. This is intrauterine transfusion. Fetus may receive a blood transfusion through the umbilical vein in the placenta. Okay, thank you for this. If you like this video, don't forget to share and subscribe the channel. We would see you in the next video. Thank you.